everyone, and welcome back to the Mental Health Matters podcast. I'm Eden, and today Sigrid is joining us to talk about mental health stigma in the workplace.
Hello, everyone.
First off, let's start by talking about mental health. What is mental health? Mental health refers to a person's state of well being, much like physical health. But instead of our organs and bodily functions, we're talking about our emotions, thoughts, and feelings, and how we cope with the highs and lows of life. One thing we have to note is that mental health and mental illness are not the same thing. Just because a person has poor mental health doesn't necessarily mean they have mental illness, and vice versa. A person with mental illness can have good mental health. However, poor mental health can eventually lead to mental illness. Our mental health can be influenced by a variety of things, such as life experiences, personal relationships, and our work or school environment.
That's right. Our mental health is just as important as physical health in the workplace. As administrative healthcare professionals, often the first and last point of contact for patients, and we manage a wide range of responsibilities behind the scenes, from scheduling appointments to data entry to processing insurance forms and supporting both staff and patients. This work can be fast paced, emotionally demanding, and at times overwhelming. And when we're struggling with our mental health, whether it's stress, anxiety, depression, burnout, or trauma, it doesn't just affect how we feel, it can impact our ability to focus, how we interact with patients and coworkers, and have a big impact on our motivation and decision making. Even our physical health can be affected, including how we sleep or how much energy we have. All of this can lead to lower productivity and our overall well being. That's why creating a supportive, stigma free environment matters so we can take care of our mental health just as much as we care for others.
Whether it be a patient living with mental illness, or a coworker, or even you yourself experiencing a mental health problem, we must know how to deal with mental health stigma in the workplace. Did you know that according to the Canadian Mental Health Association, in any given year, 1 in 5 people in Canada will personally experience a mental health problem or illness? Yet, despite how common it is, according to a study done in 2020, 47% of employed Canadians said that they felt that if they admitted to suffering from a mental illness to their boss or coworker, they felt that their ability to do their job would be questioned. What can we do to reduce this kind of stigma around mental health in the workplace?
There are many ways we can promote and support mental health in the workplace, Eden. According to the Canadian Center for Occupational Health and Safety, it starts with creating an environment where people feel safe, respected, and supported. One of the most important ways is to talk openly about mental health in meetings, emails, or casual conversations. This helps break the silence and stigma around mental health challenges. We also need to raise awareness and educate both leaders and employees. That means understanding what mental health is, recognizing when someone might be struggling, and responding with support, not judgment. Simple phrases like, it's okay to ask help, can go a long way. It's also important that support is easy to access through employee assistance programs, counseling services, or clear communication on where to get help. Um, Leaders have a big role to play when we take mental health seriously, set realistic expectations, and lead by example. They help create a culture where people feel safe to speak up. And finally, encourage work life balance through regular breaks, flexible schedules, and manageable workloads to help reduce and prevent burnout.
Well, thank you, Sigrid, for joining us today. I hope that this has been informative for everyone, and let's all try our best to take care of ourselves and others. See you on the next episode of Mental Health Matters.